Hey friends, I just want to come on, Dr. Mary Starr, if we've never met, and you're watching this live or watching this recording, just want to come on real quick because I had a good friend of mine. She reached out to me and she's having a lot of back pain. She went to her chiropractor. I mean, she's saying 8 out of 10 in terms of pain every day. And it's really, just getting to her, and she doesn't know what to do. The chiropractor took some x-rays and, she's looking at her spine, and he made a couple of comments. So I want to address with you, I want to give you some solutions for back pain on top of going to your chiropractor, right? Always going to your chiropractor is a good thing. They are, the specialists in terms of that, and they a lot of times can get you out of that acute pain as well. So first up, my friend and I have been on a health journey, and she had kind of fallen off her good nutrition, right? Everyone wants to deal with pain by doing things from the outside, helping the bone, helping the arthritides and things like that. But I can give you two people side by side. They can both have the same amount of arthritis, the same kind of arthritis, the same disc injuries, everything. And this person can be in 8 out of 10 pain, and this person can have no pain. Now, why is that? Has a lot to do with our chemistry inside and inflammation. The higher your inflammation is in the body, the more that threshold of pain and those nerve receptors are going to be fired into, because the inflammation is going to fire into the nerves. So we want to keep the inflammation down. And a lot of you know I'm a part of a program called the Rev Up Wellness Program, where we super saturate the body with good nutrition that just decreases inflammation in the body. And really, so many people are like, I sleep better, I feel better, I'm not in pain, I can get up off the couch without being stiff. Like, the list goes on and on. So that was my first recommendation to her, is you've got to get your nutrition back on track and eat the right things, including your veggies, your fruits, your good greens, and then of course our Ninja Red, our antioxidant juice. So eat good, add in the Ninja Red antioxidant juice. And a lot of people say, oh, I took Ninja Red every day, I take 2 ounces every day, I take 4 ounces. When you're trying to flush inflammation out of the body, you have to do a almost like a super saturate. We do 10 ounces a day. Yeah, 10 ounces a day for 10 days. And we super saturate, and we just flush that inflammation out of the body. And so when you're eating good and you're doing this combination of antioxidants, 10 ounces a day, it really just helps to clean the body. Now, can I take an ibuprofen or aspirin and feel better? Yes, but that's a Band-Aid. You've got to address the inflammation, right? And clean up the diet. And third thing is, get your gallon of water in a day. When you're in that much pain, you've really got to work on getting a gallon of water in a day. Hey, Michelle. Okay, so those 3 things. Next up, again, I'm going to go all internally. A lot of people are going to go for massage and stuff. I'm going to come to that, but I'm going to talk about the internal things that you can do, the things that you can control in that. And then my next couple of products that I really like for people who've been having kind of pain issues and stuff on top of the diet nutrition, you got to do that too, is the Sulfurzyme, which is MSM with a high quality wolfberry. And that wolfberry, because it's so high in vitamin C, helps the MSM really go into the cells, helps the joints, helps lubricate the body. Sometimes you'll see a difference like within the first week. Sometimes it takes up to 3 weeks to see a difference, especially those who have chronic issues and stuff. I highly recommend the Sulfurzyme. Comes in capsules and it comes in powder. Now, how much Sulfurzyme do you need? I know a woman, her name is Diana. She struggled for a long time. She takes 12 of these a day, right? 12 of these a day. She doesn't do the Ninja Red, but she does do 12 of these a day, and that's her magic number, right? She takes 4, 4, and 4. 4 in the morning, 4 in the afternoon, 4 at night. That's her magic number. You need to see with you. When you super saturate the body, you'll probably need less of these. But for my friend there who's really struggling, I would have her do at least 3, 3, and 3. Okay, 3, 3, 3. If she's doing the capsules, if she's doing the powder, the Sulfurzyme powder, I would have her put Have her Ninja Red to 4 ounces at a time with some water, and then put half a teaspoon to start, and then work herself up to a teaspoon of the sulfurzyme powder a day, maybe even 2 teaspoons. We'll see how she does with that, okay? So that's kind of the baseline where I start. Then on top of that, I would add in a product called BLM, Bone Ligament Muscle. Bone Ligament Muscle. That's what it stands for, and it really does help support the body with that. And some of our clients, on top of being on the sulfurzyme, they have to take 2, 4, 8 BLM a day, right? For them, right? For them. But each person is different, and it's not forever usually, especially if you can get the diet and nutrition and water under control. You need a lot less supplements to feel your best. But these are very safe supplements. They're not like a steroid that's going to cause the body to go into, almost like a diabetic reaction or gain weight. It's just, actually, a lot of this is going to help the body flush the inflammation, which is going to help you lose the weight too. Okay, so those are the internal things that she can do, and the sulfurzyme, BLM, and the Ninja Red are deeply discounted. If you're watching this right now, we are in November 15th until the 18th at 11:59 Mountain Standard Time, Saturday. These products are deeply discounted right now with our Black Friday sales, so make sure that you do that. Okay, so we've taken care of what so far? With the back pain. We've talked about water. We've talked about high antioxidants. We've talked about the nutrition that you have to flush the inflammation so that you're not in so much pain. Next up, right, we talked about some really good supplements that I have been working with for 25 years, and I've seen multiple patients get improvement with. Now let's talk about the topical, right? There is things like massage. Massage is so wonderful and so good, but if you don't do any of the work to this point, if you don't start stretching your body, so many times back pain, in fact, this is what the doctor was saying to her, it's like her hips were all twisted. And as a chiropractor, we know that that will happen a lot with tight muscles, and tight muscles are weak muscles, okay? So what muscles could be super tight? Your iliopsoas muscles, all of that. I have some videos on stretching and things that you can do too, but you can find all of that on Google as well. The iliotibial bands, these outside of the legs and stuff, those can get real tight, especially if you sit all day, right? So you're sitting, you're driving a lot, and you've got this tightened position. If you sleep on your side, curved up like this too, we're always in this tightened position, and we really need to open up our bodies as well too. So stretching, she needs to do her stretching and loosen up her body, loosen up the hips. You can do these hip rolls. Those are really important as well too. Okay, just moving the body kind of in circles, every joint, every single joint. Again, I have videos on that. But the next thing I would say to my friend who is struggling with pain, okay, so she's got to do the work, she's got to do the stretching, she's got to work on her core. Now, I know this friend, she has been working out. She probably has quite a tight core, so most likely it's the stretching in that piece with her too. But the doctor said, man, your x-rays looks like you're full of poop in there, right? In us women, and men too, but we carry a lot of old poop, especially if you do have a sedentary job. We're just not, even though those of us who poop regularly every single day, we just tend to carry a lot of old poop in that. And old poop will lead to inflammation, okay? You got to get the poop out. And I have some nutritionals to help you with that. I've got videos on that as well, but we got to get the poop out. So one of the essential oils that she has in her arsenal is called Digize. Okay, Digize Vitality. It's a very good essential oil. It's great for digestion. It helps in a lot of different ways. Now, it's not necessarily going to make her like run to the bathroom and poop, but it's going to support her digestion. So she can take that in a capsule. It has a strong ginger taste to it, but she can take a couple drops, 5 drops, and then work her way up to about 10 drops of the Digize. Another great essential oil that I love to have in my water every day is our Peppermint Vitality. This also is great for digestion, and it tells my body I'm full. I have it every morning when I wake up. So, you know, it kind of gets rid of that like phlegm and stuff that we have first time in the morning. Those of you who snore, you have a hard time sleeping, right? You're a mouth breather maybe. Get that peppermint essential oil. It's very good. But peppermint also kind of acts like ice. So we could use it topically on her back and on the areas that she is having pain. She also has an oil called Valor. We joke and say Valor is a chiropractor in a bottle because it really helps the muscles in the spine and the body elongate. So using that would actually be the first oil I use on her spine. Like not me, she has the oil. She can empower her health and literally put that on her back, on her spine, on your shoulders, neck, wherever the problem is, she can use that essential oil. So start with Valor oil and end with peppermint, okay? Peppermint's like your frosting on the cake. Valor's like your, okay, let's get the body settled and grounded and get the muscles and the spine relaxed. So start with Valor and end with peppermint. And then in between, because some of the things she has going on, she has the whole essential oils of the Bible kit. I was like, that's amazing. She has great oils in there that are great for topical muscle release. Things like cypress, which improves circulation. So I would be putting cypress on. Frankincense. Oh, frankincense is such a good oil. Many people like to use that to help relax the muscles, you know, a little bit of pain relief. It's just such a good oil. It's good internally too, the frankincense vitality. So I would use that topically on the area. Cypress, frankincense, cistus oil. In practice, I saw cistus oil do amazing things too. So I'd have her use cistus oil. Now, she's going to probably smell pretty strong, but so what? When you're in pain, what would you rather have, right? A drug that might be possibly addicting, or do you want to use something that's natural and good for the body and for your health, okay? So she had all of these, and then one of our favorites is called Panaway. It comes in our premium essential oil kit along with Valor, frankincense, and peppermint are all in our premium essential oil kit. She could use that oil topically on her back too. And she even said to me, she goes, yeah, when I use the oil, it really helps to relax me and calms my back down. I'm like, yeah, that's what we got to keep doing. But she's got all these oils and we just need to get her organized with them and using them consistently. Ideally, you know, when you're really hurting, every couple of hours, but at least in the morning, if you could get home for lunch and do another, you know, session at lunch and then in the evening, that would be great, or at least morning and evening would be an ideal time. Now, here's the thing too about essential oils. If I put an essential oil on my skin here, right, we would assume that it would affect the area and the muscles here. That's true. But essential oils, they're so smart. God made them amazing. They're the lifeblood of plants, right? These are not manufactured in a chemistry lab. These actually come from plants and distilled from plants. They're plant medicine, basically. And plant juice, we call them. And so you can use these essential oils and they go in the body and they can be carried throughout the body in the bloodstream. So I can use an oil here, but feel a difference here, right? I can use the oil on my feet, but feel a difference in my back. In fact, the feet are a great place to use oils if you work in an area where you can't smell. So that's a very powerful thing. So a lot of those essential oils right now, we're having a huge sale, our best sale of the year, Black Friday sale. I'll put a link in the comments too, so you can take a look at it. But if you have any questions and you want to learn more about essential oils, how to use them, anything, we even have a class coming up this Thursday, our wellness class. We have a health practitioner who specializes in using these essential oils along the spine, really helping the body flush inflammation, help muscles relax, help the body relax. A technique that I've been doing for 25 years called the raindrop technique. I would love for you to join us. Just reach out to me. Okay, this is my job. This is what I do. I help people. It is our busy season right now, but I promise we will get back to you and help you make some choices for some good health solutions, especially if you have back, neck pain, anything like that, like my friend. All right. Have a good day. Bye-bye.